Now, once the iron deficiency anemia is diagnosed, giving iron supplement is very, very necessary. So this is about the dosage of the iron for iron deficiency anemia. So whenever there is anemia, that is hemoglobin is around less than 12 gram percent, and if the peripheral smear picture shows microcytosis, hyperchromium, and when the MCV, that is mean corpuscular volume, is less than normal, the normal is 76 to 98 approximately. So that time the iron deficiency anemia is diagnosed. Now, it can be the iron can be supplemented by injectable as well as tablet form. But for injectable form, patient has to be in admitted state, or he has to stay for 2 hours, 3 hours, 4 hours. It can cause reactions also. That is the reason why it can be treated on oral basis, tablet basis. So whenever tablets has to be given, usually the iron tablets come in the form of 60 milligram of iron per tablet to 100 milligram of iron per tablet. There are so many brands, like there is Bisfer, there is Orofer, there is Sidorum. There are so many brands which come with the iron supplementation. And this iron tablet has to be given at least for 3 to 6 months. Now, 3 months or 4 months or 5 months or 6 months, it will depend on the response which the patient shows. So we can simply do a follow-up CBC or hemogram after a month, after a 2 month, after 3 months. Because follow-up hemoglobin, follow-up MCV, follow-up peripheral smear findings of microcytosis, hypochromia, if they disappear, if they improve, then we can reduce the duration. If hemoglobin reaches by 12, if these symptoms, if these signs go away, we can completely stop the iron tablets and we can facilitate the iron containing foods like almond, dry fruits, vegetables. So, the iron tablet has to be given for around 3 to 6 months, and 1 to 2 tablets can be given. Now, there are some side effects of tablets. I'll come to that later. But most of the time, once a day tablet is more than sufficient. And if the patient tolerates it very well, if the patient does get constipation, acidity, nausea, vomiting, then 2 tablets per day, one in the morning, one at the night, can be given. If the patient is admitted for some reason, suppose the patient has pneumonia or LRTI or AGE or UTI, and you find out that patient also has anemia and patient has severe iron deficiency anemia, then when the patient is supposed to get some injectable, we can simply give injection iron with that IV fluids. Now, for that, we have to calculate the iron deficit. Now, how we can calculate the iron deficit is, what we do is we take the target hemoglobin minus patient's hemoglobin. We multiply it by weight of the patient in kilogram into 2.3, which is a constant, and this constant will be constant in all the cases, plus 500 to 1000 milligram as a reserve of iron, as an extra iron that we'll give to the patient. Now, for example, if the patient hemoglobin is 6 and our target of HB is around 12, it can be 13, 14, 15 as well. But in our case, we'll take like 30 is descent, 12 is descent, so we'll take 12 as a descent target. And if the weight of the patient is 50, then as per this formula, target hemoglobin is 12 minus 6 into patient's weight into 2.3, which is constant, plus this as a reserve that will be giving as extra iron. So it is around 300 into 2.3, so 690 milligrams plus 500 to 1000. So it will come around 1200 milligram to 1.5 gram. So we must know that injection iron comes into either 100 milligram in ampule or 500 milligram ampule. So they very commonly come in 500 milligram and 1 gram. They are very, very easily available. And 100 milligram, they are slightly less easily available. So we usually prefer 500 multiplication dosage, like 500 or 1 gram or 1.5 gram or 2 gram. So we can give this patient 1 gram to 1.5 gram also. On the first day we can give 500 and next day we can give 1 gram. The injection preparation for iron which are preferred, they are ferroxymaltose, carboxymaltose, because earlier there were iron dextran, iron sucrose, they were highly antigenic and there were so many allergic reactions, anaphylaxis reactions. That is the reason why these newer iron injections of ferroxymaltose, carboxymaltose are much, much preferred. This injection iron must be first skin tested, Many of the places they give very little amount of this injection iron in diluted form, like 2 to 5 ml. They first give it by IV route, and if the patient doesn't get any reaction, then they give the remaining dose. But the best is skin testing. This injection iron must be diluted in at least 250 ml to 500 ml of NS, and it should be given at least over 2 to 5 hours, even though it can be given over a period of 1 hour also. But most of the time, I prefer giving these injections at least over 3 to 5 hours slowly at around 60 to 100 ml per hour after dilution. Oral tablets very commonly causes gas, bloating. Constipation is extremely common problem with the iron tablets, and acidity GERD can also be. So these things has to be kept in mind. And iron-rich food like dry fruits, fruits, vegetable, cashew, paneer, milk products, curd. These are very good source of iron. Non-veg, eggs. This is also a very good source of iron. This can be facilitated to treat the anemia. Thank you.